door, provide for privacy, and perform hand hygiene. Hi, my name's Lily. I'm going to be your nurse today, and we'll be doing a physical assessment. Is that okay with you?
Yeah, that's fine, Lily.
All right. What is your name and date of birth?
My name is Mac. My date of birth is 2/6/94.
Can I check your ID band?
Sure.
All right. That is correct. Patient appears to be stated age, is appropriate color for his ethnicity, and we'll go ahead and I'm going to ask you some questions if that's okay with you.
Yep.
All right. Are you having any homicidal or suicidal thoughts?
No, ma'am.
Okay. Are you having any anxiousness?
No, ma'am.
Any shortness of breath?
No, ma'am.
Okay. Any loss of appetite?
No, ma'am.
Any distress?
No, ma'am.
And are you in any pain?
No, ma'am.
All right. What is the year?
2023.
Okay. And do you know where you're at?
The doctor's office.
And what are we doing today?
Physical assessment.
Okay. And who is the coach of Ohio State football?
Ryan Day.
Okay. Patient is alert and oriented ×4. So we'll be going on to the vital signs. Okay.
Okay.
Okay. Patient's blood pressure is 114/75. Pulse is 72. Respiratory is 16. So we'll go ahead and check your temperature. It is 98.6, so that is normal. We'll go ahead and assess your gait, okay?
Okay.
So I'm going to have you stand up. I'm going to have you take 2 steps towards me. Okay, and turn around and take 2 steps back. Okay, gait is well coordinated. He is not unbalanced in any way. His upper and lower extremities are equal, so there's no issues there. We'll go ahead and do some range of motions, okay?
Okay.
So I'm going to have you stick your arms out and do a supination. Okay, now put them out to your side, and then up, and then put them back down. Okay, now we're going to check your resistance. So don't let me push out. Okay, don't let me push in. Okay, don't let me push down. Okay, don't let me push up. And grasp. Okay. Patient's strength and resistance is ×5. No issues there. Upon doing resistance, there is no edema or lesions or redness on the arms. So we'll go ahead and I'm going to have you bend over and touch your toes so I can check for some scoliosis. Okay, there is no signs of scoliosis. We're going to move on to your leg range of motions, okay? So I'm going to have you put your leg out medially, keep your knee straight. Perfect. You can put it back now. Do the opposite leg. Okay. Now I'm going to have you take that left leg again, laterally, knee straight. Okay. Next leg. Perfect. Now I'll have you sit down and we'll do some resistance on your legs, okay? Right. So don't let me push out. Okay. Don't let me push in. Okay. Don't let me push down. Okay. Don't let me push up. Okay. Right. Now we'll do your plantar flex and your dorsiflex. So don't let me push up. Okay. Don't let me push down. Okay. Don't let me push up. Okay. Don't let me push down. Perfect. Now I'm going to do your capillary refills, okay? Capillary refills are about less than 3 on both feet. I'm going to check your pedal pulses, okay? Pedal pulses are +2 bilaterally. There is no lesions or redness on the feet and the heels, so there's no issues there. The right leg also has no lesions or any redness that need to be looked at. Temperature of his legs are warm. No issues there. The color is matching the rest of his. There's no excessive redness or any irritation that we can see as well. So we'll go ahead and move on to your head and neck assessment, okay? So I'm going to inspect your hairline and your beard for any infestations, masses, or any lesions, okay?
Okay.
Check your beard. Upon inspecting his hair and his beard, there are no infestations, no lesions, and no masses. So now I'm gonna move on to your facial features. Okay, your eyes seem to be equal to the rest of your face. Your head is proportionate to your body, and your ears are equal on both sides. So there's no issues there. So we'll move on to your ears. I'm gonna check for some lesions, any edema, any foreign bodies in the ears, any excessive wax, or any drainage. Okay.
Okay.
The left ear has no lesions or edema, no foreign bodies, excessive wax buildup, or any drainage. So move on to the right. The right ear has no swelling, no edema, no lesions. There are no foreign bodies in the ear, no excessive earwax or excessive drainage. So I'm gonna go ahead and do a whisper test while I'm on both your sides, okay?
Mac.
Okay, perfect.
Mac.
Okay, perfect. Now I'm gonna come up behind you and I'm going to do your peripheral vision, okay?
Okay.
Just tell me whenever you see my hands, okay?
See you.
Okay, perfect. Now I'm going to have you follow my pen light with your eyes. Perfect. Good. Now I'm gonna look at your pupils. The pupils are equal, round, reactive, and accommodating to light. Do you wear any glasses or contacts?
No, ma'am.
Okay, so we have no issues with that. So I'm gonna have you read the numbers off my pen light.
2, 3, 4, 5, 6, 7, 8, 9 millimeter.
Perfect. Okay, so I'm gonna have you tip your head back, and I'm going to look in your nose for any drainage or foreign bodies. Okay. No foreign bodies are present in the nose. There is no excessive drainage, and there is no foreign bodies in the nose. And the nose is dry. So I'm gonna move on to your mouth. Okay, so I'll have you open up so I can look in it. There are no lesions on the roof of the mouth. There are no lesions under the tongue. The mouth is pink. There's no excessive redness. And the oral mucosa is good. I'm gonna have you swallow for me. Good. Can I have you say a few words to me?
Sure. What would you like to do today, Lily?
Okay. The speech is not slurred, very clear, so no issues with that. So we'll go ahead and we'll move on to your cardio.
Okay.
So first, I'm going to check your skin trigger. The skin has some elasticity to it, so there's no signs of any dehydration. So that is good. Now I'm going to listen to your heart sounds, okay?
Okay.
I'm going to listen to your aortic, your pulmonic, your tricuspid, and your mitral. Perfect. Heart sounds are good. There are no sounds of murmur. So I'm going to go ahead and do your pulses, okay?
Okay.
So I'm going to do your carotid. Right side carotid is 2+. Left side carotid is 2+ as well. So carotid pulses are 2+ bilaterally. We'll go ahead and do your radial. Radial pulses are 2+ bilateral as well. I'm going to go ahead and I'm going to do your capillary refills on your fingers, okay? Capillary refills are less than 3 seconds, so that is good. There is no skin breakdown on the chest or the stomach. There is no excessive redness, no irritation. So we are good on all of those parts. And we'll move on to your respiratory. Okay. So I'm going to listen to 10 locations anterior on your anterior.
Okay.
And then we'll go from there, okay?
All right.
Just breathe in whenever my stethoscope is on you. Okay, anterior lung sounds are equal and clear. So I'm gonna go ahead and move on to your back, to your posterior lung sounds, okay?
Okay.
Just breathe in whenever my stethoscope's on your back. Okay, all 10 locations for the posterior lung sounds are clear and equal. So I'm gonna move on to your lateral lung sounds, okay? Okay, lateral lung sounds are clear and equal. So I'm going to place my hands on your lower back and have you breathe in so I can check for symmetry whenever you breathe.
Okay.
Okay, take a deep breath. Okay, breaths are symmetric. There is no redness or skin breakdown on the lower back, no lesions, so we are good there. Now I'm going to move on to your gastrointestinal, okay?
Okay.
So I'm going to listen to your lung sounds and then I'm going to palpate, okay?
Okay.
Bowel sounds are heard in all 4 quadrants. I'm going to palpate your stomach now. Are you having any pain anywhere as
No,
I'm
ma'am.
touching? Okay. Stomach is tender and palpable. Are you having any constipation, diarrhea?
No, ma'am.
Okay. When was your last bowel movement?
This morning.
Okay. And then are you having any nausea or vomiting?
No, ma'am.
Okay, perfect. So we're gonna move on to your genital urinary. So are you having any issues starting a stream?
No, ma'am.
Or is your urine normal colored?
Yes, ma'am. It's like a light yellow, green, or clear.
Okay. So are we having any issues when urinating?
No, ma'am.
Is there any urgency to go urinate?
No, ma'am.
Okay, and how frequent are you urinating?
Every few hours.
Okay, that is the end of our physical assessment. Do you have any questions?
No, Lily, I sure don't.
Have you been in pain at all throughout this experience?
No, ma'am.
All right, we are done.